this is the medial end. The medial end has 4 surfaces. The one surface which you can see from the front like this is the anterior surface. Here you can see, here are some muscles attached, but we will talk in other aspect. If you can see, this is the anterior surface, and one, it has the superior surface. If you talk about the anterior surface, this hole is the, if I mark with the pencil, this anterior surface gives attachment to the pec major muscle. Our pec major muscle, which is which comes from the, which gets attachment from the hair, from the sternum, and then this is how the main pec major we will see on the muscular muscular model. Then you talk about the superior surface, the just above it we have a superior surface. The medial aspect, if I mark with the pencil, the medial end, or what we can say, the medial aspect of the superior surface of the clavicle bone gives attachment to the sternocleidomastoid. If we will see the muscle sternocleidomastoid. So the clavicle part of the sternocleidomastoid SCM, which is commonly called the SCM muscle, the clavicular part gets attachment here on the superior surface, the medial border of the medial half of the superior border. Then if I show you on this, here you can see, okay. So this surface is the anterior surface, which gives attachment to the pectoralis major muscle, the pectoralis clavicular part of the pectoralis major muscle. This is the superior surface. This part gets attachment. So it has basically the 4 surfaces: the anterior surface, and then you have a superior surface. Then you have a posterior surface, which also gives attachment to the sternohyoid, coming from the sternum to hyoid bone. Okay? And then finally you have an inferior surface. There are some special inferior means down. So it has also the inferior aspect we will see. On the medial 2/3 we have also an inferior surface. There are some special landmarks on the inferior surface. If I show you on this, okay, this is your inferior surface. So here you can see there are some this groove. If I mark with the pencil, this groove is called the subclavian groove. So the name itself is indicating here is the attachment of the subclavius muscle. Here this groove is called the subclavian groove, and this groove has 2 lips. If you can see, these lips are the outer lip or inner lip. It has 2 basically, you can see the lips as a margin. So it has 2 margins basically, the outer one and the inner one. They give attachment to clavipectoral fascia. There is a fascia which are between the clavicle and the pectoralis. So that fascia gets attachment from the margin of these lips, the outer lip and inner lip. And then when you come toward the laterally toward this side, you will feel here as a foramen. This foramen is the nutrient foramen. So in inferior surface there are the special 3 points that you need to be for a viva or clinical perspective: the subclavian groove which gives attachment to the subclavius muscle, and then you will find a nutrient foramen at the lateral margin of the subclavian groove, and then you will find the outer and inner lips or outer and inner margins of the what we can say the subclavian groove, which gives attachment to the clavipectoral fascia. So this was all about the surfaces. You have 4 surfaces: the anterior surface, the superior surface, the inferior surface, and then you have a posterior surface. The all are connecting with they give some sort of the attachment. Like if you talk about the acromial end, it has anterior border which has a deltoid tubercle. So the name itself indicating it will give attachment to the deltoid muscle. If you talk about the posterior border, this is the posterior border that gives insertion to the trapezius muscle. If you talk about the inferior surface, it has subclavian groove, as we already discussed. It gives attachment to the origin to the subclavian muscle. When you talk about the anterior surface, it gives attachment to the pectoralis major. When you talk about the superior surface, it gives attachment to the sternocleidomastoid. When you talk about the posterior surface, it gives attachment to the sternohyoid. So if I show you on the muscular and ligaments attachment, here I need to move on the left side. So if I turn this skeletal little bit, okay. Now here is the mask just because of the COVID condition. So that's a sign. there's a sign.
Audio Jungle.